Welcome to the third section of your NREMT exam prep course, focusing on cardiology and resuscitation. In this exciting module, we will explore the human cardiovascular system, how to recognize acute coronary syndrome, and the life-saving protocols for cardiac arrest. This topic is incredibly important because cardiac emergencies are some of the most time-critical calls you will ever run. And your quick actions can mean the difference between life and death. I am thrilled to walk you through these high-stakes concepts, preparing you to act with total confidence when every second counts. Let us dive into the heart of emergency medical services and elevate your life-saving skills. To lock in these foundational concepts early, I highly recommend obtaining our practice tests or downloading the offline app, which are excellent educational tools to test your knowledge as you progress through the course. To understand cardiac emergencies, we must first look at the basic anatomy of the human heart, which is a muscular organ responsible for pumping blood throughout the body. The heart is divided into 4 chambers, with the top 2 chambers called the atria and the bottom 2 chambers called the ventricles. The right side of the heart pumps oxygen-poor blood to the lungs, while the left side pumps oxygen-rich blood out to the rest of the body. You should visualize the heart as a high-performance engine, relying on a constant supply of fuel and electricity to keep the body functioning perfectly. The heart muscle itself, known as the myocardium, cannot extract oxygen from the blood inside its own chambers. Instead, it relies on a dedicated network of blood vessels called the coronary arteries, which wrap around the outside of the heart. These tiny arteries deliver oxygen-rich blood directly to the heart muscle cells, ensuring the pump has enough energy to beat continuously. A critical concept for the exam is understanding that any blockage in these specific arteries will starve the heart muscle of oxygen, leading to devastating cardiac emergencies. When a coronary artery becomes partially blocked, usually by a buildup of fatty plaque, the heart muscle experiences a lack of oxygen, a condition known as ischemia. This oxygen starvation causes a specific type of chest pain called angina pectoris, which typically occurs during physical exertion or emotional stress. Angina usually resolves with rest or after the patient takes the prescribed nitroglycerin medication, leaving no permanent damage to the heart muscle. On the certification exam, a scenario describing chest pain that goes away completely with rest is a classic presentation of stable angina. If a coronary artery becomes completely blocked by a blood clot, the heart muscle cells begin to die within minutes, causing an acute myocardial infarction, which is the medical term for a heart attack. Unlike angina, the pain from a heart attack does not go away with rest, and the death of the heart tissue is permanent. Patients often describe this pain as a crushing heaviness, or an elephant sitting on their chest, which may radiate to the left arm, the jaw, or the back. You must recognize these signs immediately, because saving the heart muscle requires rapid transport to a specialized hospital that can clear the blockage. Because it is impossible to distinguish between severe angina and a true heart attack in the field without advanced testing, EMS providers use the umbrella term acute coronary syndrome. Acute coronary syndrome refers to any group of symptoms caused by myocardial ischemia, prompting you to treat all such patients with the same high level of caution. Your primary goal is to recognize the potential for a heart attack, provide supportive care, and initiate rapid transport. Exam questions will frequently use this term, testing your ability to assume the worst-case scenario and treat accordingly. A very important exam topic is recognizing that not everyone experiences the classic crushing chest pain during a heart attack. Women, the elderly, and diabetic patients frequently present with atypical symptoms, meaning their signs of a heart attack are unusual or subtle. Instead of chest pain, these special populations might complain of sudden weakness, unexplained nausea, indigestion, or shortness of breath without a clear cause. You must maintain a high index of suspicion for acute coronary syndrome whenever you encounter a geriatric or diabetic patient feeling suddenly unwell. To see exactly how these tricky, atypical patient presentations are formatted on the actual NREMT. Utilizing the practice tests or reviewing scenarios on the offline app can serve as a highly effective addition to your study routine. One of the most important medications an EMT can administer for acute coronary syndrome is aspirin. Aspirin does not relieve pain, nor does it dissolve the existing blood clot blocking the artery. But it does prevent the clot from getting any larger. It works by making the tiny blood cells called platelets less sticky, keeping them from clumping together at the site of the blockage. For the exam, you must remember the standard dose is up to 324 milligrams of chewable baby aspirin. And you must verify the patient has no allergies or history of severe internal bleeding before giving it. Nitroglycerin is another medication you might assist a patient with during a cardiac emergency, provided it is prescribed to them by their doctor. This medication is a vasodilator, meaning it relaxes and widens the blood vessels, which decreases the workload on the heart and allows more blood to flow past partial blockages. It is administered as a small tablet or a spray placed directly under the tongue, where it absorbs rapidly into the bloodstream. Because it dilates blood vessels, nitroglycerin can cause a dangerous drop in blood pressure. So you must always check the vital signs before giving it. The certification exam loves to test the strict contraindications for nitroglycerin, which are conditions where giving the medication could harm or even kill the patient. You absolutely cannot give nitroglycerin if the patient has a systolic blood pressure below 100. Or if they have a severe head injury. The most critical, heavily tested contraindication is asking if the patient has taken any erectile dysfunction medications, like Viagra or Cialis, within the last 48 hours. Combining nitroglycerin with these specific drugs causes a fatal drop in blood pressure, making this a mandatory question on every cardiac call. Another major cardiac emergency is congestive heart failure, which occurs when the heart loses its ability to pump effectively, causing fluid to back up into the body. If the right side of the heart fails, fluid backs up into the body, causing swelling in the legs, ankles, and abdomen, known as pedal edema. If the left side of the heart fails, fluid backs up into the lungs, a life-threatening condition called pulmonary edema. Exam scenarios featuring a patient waking up in the middle of the night gasping for air, with pink frothy sputum and crackling lung sounds, are pointing directly to left-sided heart failure. Despite your best efforts, some patients will deteriorate into cardiac arrest. which means the heart has completely stopped pumping blood. When this happens, the patient will immediately lose consciousness, stop breathing, and lose their pulse, triggering a massive adrenaline rush for you and your partner. This is the moment where high-performance CPR becomes your primary focus, acting as a manual pump to circulate oxygenated blood to the brain. In these scenarios, time is your greatest enemy, as brain damage begins within 4 to 6 minutes of the heart stopping. High-performance CPR requires extreme precision, focusing on the correct depth, rate, and minimal interruptions during chest compressions. For an adult, you must compress the center of the chest at least 2 inches deep, at a rate of 100 to 120 compressions per minute. You must also allow the chest to fully recoil after every single push, which creates a vacuum that pulls fresh blood back into the heart chambers. The exam will heavily test your knowledge of these specific metrics, as flawless compressions are the single greatest factor in patient survival. While compressions circulate the blood, you must also provide artificial ventilations to keep that blood oxygenated. During adult CPR with an unprotected airway, the standard ratio is 30 compressions followed by 2 breaths using your bag valve mask. A common mistake candidates make is squeezing the bag too forcefully. But you only need to provide enough air to make the chest rise visibly. Overventilating a patient in cardiac arrest increases the pressure inside the chest cavity, which physically prevents blood from returning to the heart, destroying the effectiveness of your compressions. The automated external defibrillator, or AED, is a miraculous device designed to cure specific lethal heart rhythms during cardiac arrest. It is important to know that an AED does not restart a completely dead, flat-lining heart, which is called asystole. Instead, it looks for chaotic, disorganized electrical activity, known as ventricular fibrillation or ventricular tachycardia, and delivers a massive shock to stun the heart muscle. This shock stops all electrical activity for a split second, hoping the natural pacemaker of the heart will reset and begin beating normally again. When an AED arrives on the scene of a cardiac arrest, you must turn it on immediately and follow the voice prompts without delaying chest compressions. You will apply the sticky pads directly to the bare chest of the patient, placing one on the upper right side and the other on the lower left side. The most critical safety rule, heavily tested on the NREMT, is ensuring that absolutely no one is touching the patient while the machine analyzes the rhythm or delivers a shock. You must loudly declare that everyone needs to stand clear, visually confirming your partners are safe before pushing the shock button. You must also be prepared to adapt your AED application for special situations in the field. If the patient has a medication patch on their chest, you must remove it with a gloved hand and wipe the skin clean before placing the pad. If the patient has a wet chest from drowning or heavy sweat, you must quickly dry the skin so the electricity travels through the heart instead of across the surface of the water. Furthermore, if the patient has a visibly implanted pacemaker, you must place the AED pad at least 1 inch away from the device to avoid blocking the shock. Your ultimate goal during cardiac arrest is achieving the return of spontaneous circulation, commonly abbreviated as ROSC. You will know you have achieved this when you feel a palpable pulse return during a pulse check, or if the patient suddenly starts breathing on their own or moving. Once ROSC is achieved, you must immediately stop CPR and transition into post-resuscitation care, focusing on keeping the patient stable. The exam will test your next steps, which typically include securing the airway, supporting ventilations, maintaining blood pressure, and initiating rapid transport to the hospital. Successful cardiac resuscitation relies entirely on excellent teamwork and the concept of the pit crew model. In this model, every responder has a predefined role, such as compressor, airway manager, or AED operator, preventing chaos and ensuring smooth transitions. Because high-quality compressions are physically exhausting, you must rotate the person doing compressions every 2 minutes to prevent fatigue from lowering the quality of the pumping. The NREMT exam will frequently evaluate your understanding of team dynamics, highlighting that seamless communication and structured roles are vital for saving lives. I want to congratulate you for completing this intense and vital section on cardiology and resuscitation. I highly encourage you to complete the attached practice tests for this module, or download our offline app to continue reviewing these high-stakes protocols on the go. Tackling realistic exam scenarios is the best way to improve long-term retention and build true exam readiness. You will find that the practice tests and offline app are included with this course to ensure you can confidently recognize and treat these time-critical emergencies. Keep engaging in active learning, because the knowledge you are building right now will save lives in the real world. Let us carry this positive momentum forward, naturally transitioning to the next section where we will explore a wide variety of medical emergencies and toxicology.